I'm Alex Villarreal with the VOA Special English Health Report. Every year, 1 million women around the world are found to have breast cancer. Almost 200,000 others are told they have ovarian cancer. The decisions for treatment are more difficult when the women have abnormal versions of two genes called BRCA1 and BRCA2. The mutations in these genes can also increase the risk for other kinds of cancer, including cancer of the cervix, uterus, and pancreas. Sandra Cohen has never had breast cancer or ovarian cancer, but she has the BRCA1 and BRCA2 mutations, so she decided to have doctors remove her breasts and ovaries. She made the decision after her mother and grandmother both died from the same kind of cancers. Doctors have known for several years that preventative surgery reduces the risk of ovarian and breast cancer for women with the mutations. But a new study also shows that these operations help those patients live longer. The 4-year study involved about 2,500 women with the genetic mutations. One of the researchers was Dr. Susan Domchek at the University of Pennsylvania School of Medicine. She said, women who had their ovaries removed had a decrease in the risk of breast cancer and a decrease in the risk of ovarian cancer. In addition, they were less likely to die of breast cancer, less likely to die of ovarian cancer, and also had an improvement in their overall survival. The study found that none of the women who had preventative breast removal developed breast cancer. 7% later did among those who decided against the surgery. The rate of breast cancer was also 7% among women who did not have their ovaries removed. Among those who did, the breast cancer rate was 1%. The study also found that the women who had their ovaries removed lowered their risk of death from ovarian cancer by almost 80%. Their risk of death from breast cancer was 56% lower, says Dr. Domchek. The researchers say women with a strong family history of breast or ovarian cancers should get genetic testing. Sandra Cohen did. She says, do some research with a genetic counselor. Meet some other women who have gone through it. It really will empower you to take some action. The study appeared in JAMA, the Journal of the American Medical Association. For VOA Special English Health Report. Rachel Valtos and Evan Saperstein are dentists who share an office and a life together near Washington, D.C. In 9 years of marriage, they have built a successful dental practice and a family. Rachel and Evan laugh about the last time they argued at home. He wanted her attention. So did one of their 3 children. Evan yelled at the child. Rachel told Evan that he was the one acting like a baby. That only brought more yelling, which Rachel ignored. She says in the heat of the argument, she usually will back away because she wants to avoid confrontation in front of her children. But she always plans to have a discussion about it later. Rachel and Evan made peace. But researchers might describe the way she dealt with the argument at first as a withdrawal strategy. A team at the University of Michigan recently published a study of how married couples fight. They also looked at how different kinds of arguing might predict the future of a marriage. The study followed 373 couples over 16 years. 46% of them had divorced by the final year in 2002. The couples were asked at 4 different times to report on their most recent conflict. The husbands and wives each had to choose from a list of behaviors to describe the strategies they used. The list included behaviors like calm discussion, listening, and trying hard to find out the other person's feelings. The list also included yelling, using insults, walking away, or not communicating. Assistant Professor Kira Burdett led the study. She said the husbands were more likely to use constructive strategies, like discussing the problem and finding solutions. The wives were more likely to use destructive or withdrawal strategies. But she says the study found that over time, wives became less destructive in the way they argued. Husbands stayed the same. She says the researchers also found that different combinations of strategies may help predict whether a couple will stay together. The chances decrease if only one partner uses constructive strategies. So now, back to Evan and Rachel. We spoke with Evan Saperstein just after he finished a long, difficult root canal on a patient. If he had to choose between another operation like that or a fight with his wife, which would he choose? He said, "Oh, definitely the root canal." For VOA Special English, I'm Alex
Ritter with the VOA Special English Health Report. No one wants a pilot to make a mistake. This is why flight crews are trained in teamwork and communication. Now, a study finds hospitals that trained their operating room teams have a lower rate of surgical deaths than other hospitals. The study is in the Journal of the American Medical Association. It involved more than 100 American hospitals for veterans. Some had taken part in a program of medical team training. Researcher Julia Neely, a Veterans Administration nurse, says the training seeks to empower each team member, including technicians. She says everyone in the operating room could bring up any concerns they had about the patient. And the more training, the better the chances that a patient would survive. Study co-author James Bajan is a Veterans Administration doctor. He says better communication improves teamwork. At first, some team members questioned the value of the communication training. But another new study shows how a lack of communication can lead to mistakes, like operating on the wrong part of the body or the wrong patient. Since 2004, hospitals and surgical offices in the United States have had a universal protocol. For example, they are supposed to mark the area to be operated on and perform a timeout immediately before the procedure. The study looked at records of a company that provides liability insurance to 6,000 doctors in Colorado. The doctors reported 25 cases involving the wrong patient between 2002 and 2008. 5 patients suffered serious harm. Surgeons and other doctors also reported 107 cases involving the wrong site. More than 1/3 led to serious harm. 1 patient died. The researchers blamed most of the wrong site cases on errors in judgment or a lack of a timeout. But they say errors in communication were at least one cause of all the patient mix-ups involving the wrong patient. Philip Stahel at the Denver Health Medical Center led the study in the archives of surgery. For VOA Special English, I'm Mario Ritter. You can find other health reports online at voaspecialenglish.com. You can also follow us on Facebook, Twitter, and iTunes at VOA Learning English.
Royale with the VOA Special English Health Report. An outbreak of cholera in Haiti continued to spread sickness and worry. Health officials worried that the capital could suffer a major outbreak of the disease. By the middle of November, most cases in Port-au-Prince were found in people who arrived in the city already sick. But health officials confirmed the first case in a boy who had not left the city for at least a year. And there were other suspected cases in the Haitian capital. Cholera causes diarrhea and vomiting. It robs the body of fluids. People can get cholera if they eat foods or drink liquids containing the bacteria that cause the infection. Cholera is not hard to treat. Basically, patients drink a solution of salt, sugar, and water. The problem is that help is not always available quickly. If cholera is not treated, it can kill within hours, especially in people already in weakened conditions. The earthquake in January displaced large numbers of people. It forced them into crowded, dirty conditions in tent camps. In other words, the perfect environment for cholera. The outbreak in Haiti has already killed several hundred people. The country's last major outbreak of the disease was more than 100 years ago. Disease control experts from the United States confirmed the first cases of cholera in Haiti on October 21st in the Artibonite area. The outbreak was mostly limited to that area until a powerful storm struck Haiti in November. Hurricane Tomas caused heavy rains and flooding and some deaths. The number of cholera cases had been dropping, but then rose sharply after the storm. Medical workers in Haiti were trying to spread the message not to use river water without some form of purification. People were being urged to take steps like adding a small amount of bleach to the water or boiling it for at least a full minute. Workers were also struggling to provide clean bottled water and water purification tablets. People were being urged to wash their hands carefully with soap and purified water after using the toilet or changing a baby's diaper. The same advice goes for washing hands before eating and before and after preparing food. If no soap is available, then ash can be used instead. For VOA Special English, I'm Alex Villarreal. You can read transcripts. Alex Villarreal with the VOA Special English Health Report. World AIDS Day was December 1st. This year, experts reported more signs of success in halting the AIDS epidemic. The number of AIDS-related deaths and the number of new infections are both decreasing. Michelle Sidibe is the executive director of the Joint United Nations program known as UNAIDS. He says today, we can say that we have changed the direction of the AIDS pandemic. The latest UNAIDS report says new HIV infections have fallen almost 20% in the last 10 years. And there has been a similar drop in the last 5 years in the number of AIDS-related deaths. An estimated 33 million people worldwide were living with HIV last year. 2.5 million were children. HIV is the virus that causes AIDS. Africa, south of the Sahara, has the most deaths and new infections. But many of those countries have made important progress. Worldwide estimates show that more than 2.5 million people became infected with HIV in 2009. At the same time, about 1,800,000 people died from AIDS-related sicknesses. Drug treatment to suppress the virus has expanded. One result has been fewer babies born infected by their mothers. Still, the report says 10 million people are waiting for treatment. UNAIDS officials also say not enough is being spent for prevention. They say prevention efforts are responsible for much of the progress. More and more young people say they are following safer practices. Surveys find greater use of condoms, and people in many countries say they have fewer sexual partners. World Health Organization chief Margaret Chan called this year's AIDS report encouraging. But she noted that the populations most at risk are also those who have the least access to services. These populations include sex workers, drug users, and homosexual men. In other health news, a new study has found that 1 in every 100 deaths in the world is caused by other people smoking. Researchers found that more than 600,000 non-smokers died in 2004. They say the deaths were from diseases and infections caused by secondhand smoke, also known as passive smoking. The study in the journal Lancet says 165,000 of those tobacco victims were children. For VOA Special English, I'm Rael with the VOA Special English Health Report. Doctors currently identify autism disorders by observing behavior. Autism affects social and communication skills. It usually first appears in young children. Now, researchers in the United States think they have found a biological test for autism. A team from Harvard University in Massachusetts and the University of Utah developed it. The test uses an MRI, or magnetic resonance imaging machine, to look for abnormalities in the brain. Other studies have not shown major structural differences between the brains of autistic people and those without autism. But the latest study did not look at the large structures of the brain. Instead, Harvard's Nicholas Lang says the team looked at the circuitry, the chemical and electrical pathways that link the different parts of the brain. He says, the brain may be okay. The parts that do the work may be okay. But the wiring, the cables between the points in the brain, one to another, may be disrupted in some way. The scientists did MRI scans on 60 males between the ages of 8 and 26. 30 of them had been identified as having mild autism, a form also known as high-functioning autism. The researchers looked at the connections in two areas of the brain that control language and social behavior. They used a technique called diffusion tensor imaging. This way, they could observe microscopic fibers to see how well the brain circuitry was organized. Nicholas Lang says the pictures showed a clear difference between the people with autism and those without. He compared it to spaghetti. He says uncooked spaghetti is well organized and straight, but cooked spaghetti is tangled, and that's the way the wiring can be. It can be either very tangled or it can be very organized. The researchers say the tests were able to predict with 94% accuracy which of the people had been found to have autism. The researchers repeated their study with new participants and got equally strong results. But Dr. Lang says the test is not ready yet for general use. The study was small and only involved males. It also used older children and adults. Dr. Lang says that in time, the test might be able to identify autism in children under 3. 3 is currently the youngest age at which most doctors will diagnose an autism disorder. But most parents begin to suspect a problem by the age of 2. For VOA Special English, I'm Alex Villarreal. Alex Villarreal with the VOA Special English Health Report. When parents go to work, their young children often spend the day in childcare. That contact with other children can make it easier to get sick. But new research suggests that this might have a protective effect a few years later when children start school. A research team looked at data from a large study. That study followed the health of a group of Canadian children for almost their first 10 years of life. Silvana Cote at the University of Montreal led the research team. She says some of the children were more likely to get sick from the kinds of infections commonly passed around at a daycare center. But she says these children were also more likely to avoid infections when they entered elementary school a few years later. Silvana Cote says her study was not really designed to explain why children who started daycare early with many other children had fewer infections later. But she says there is a non-medical reason why getting sick early might be better. It reduces the risk of having to stay home from school. She says missing school when children are starting to learn to read or write, may cause more problems than missing daycare days. The research appears in the Archives of Pediatric and Adolescent Medicine, a journal of the American Medical Association. Some diseases can be prevented by vaccines. In December, the World Health Organization launched the first vaccine ever developed for Africa. The vaccine is designed to provide 10 years of low-cost protection against meningococcal A. This bacterial form of meningitis can cause brain damage and death. Major epidemics strike Africa every 7 to 14 years. Children and young adults are the hardest hit. In 2009, an outbreak across sub-Saharan Africa killed more than 5,000 people. The WHO says as many as 450 million people across Africa are at risk from meningitis. The new vaccine is called Men-Afravac. It can be given to children as young as 1, which is earlier than vaccines currently used to fight meningitis epidemics in Africa. Health workers launched the new vaccine in Burkina Faso in West Africa. There are 25 countries along Africa's so-called meningitis belt, from Senegal to Ethiopia. The hope is that people in all 25 countries will be protected against the disease by 2015. I'm Alex Villarreal with the VOA Special English Health Report. Freezing weather can mean frostbite and hypothermia unless a person is prepared. Today, we talk about how to stay warm, dry, and safe. Frostbite is damage that happens when skin is exposed to extreme cold for too long. It mainly happens on the hands, feet, nose, and ears. People with minor cases of frostbite that affect only the skin may not suffer any permanent damage. But if deeper tissue is affected, a person is likely to feel pain every time the area gets cold. If blood vessels are damaged, people can suffer a gangrene infection. Sometimes the only way doctors can treat an injury like this is to remove frostbitten areas, like fingers and toes. Hypothermia is a condition that develops when the body cannot produce as much heat as it releases. Signs of hypothermia include uncontrollable shaking, very slow breathing, and difficulty thinking clearly. Hypothermia can lead to death if the person does not receive help. To avoid cold-related injuries, here is a simple way to remember 4 basic steps to staying warm. Think of cold, C-O-L-D. The C stands for cover. Wear a hat and scarf to keep heat from escaping through the head, neck, and ears. And wear mittens instead of gloves. In gloves, the fingers are separated, so the hands might not stay as warm as they would in mittens. The O stands for overexertion. Avoid activities that will make you sweaty. Wet clothes and cold weather are a dangerous combination. L is for layers. Wearing loose, lightweight clothes, one layer on top of another, is better than wearing a single heavy layer of clothing. Make sure outerwear is made of material that is water resistant and tightly knit. D is for dry. In other words, stay as dry as possible. Pay attention to the places where snow can enter clothing. These include the tops of boots, the necks of coats, and the wrist areas of mittens or gloves. And here are two other things to keep in mind, one for children and the other for adults. Eating snow might be fun, but it lowers the body's temperature. And drinking alcohol might make a person feel warm. But what it really does is weaken the body's ability to hold heat. Next week, advice from experts about what to do and not to do to help someone who is injured by cold weather. I'm Alex Villarreal with the VOA Special English Health Report. Many people have low amounts of iron in their blood, but pregnant women need extra iron for their own health and their baby's health. Iron is important to the development of a baby's brain and central nervous system. In poor countries, however, providing all pregnant women with iron supplements can be a financial issue. Some experts say giving supplements to babies after they are born is enough. Someone who disagrees is Parul Christian, a nutritionist at the Johns Hopkins School of Public Health in Maryland. She and other scientists have been doing research in Nepal. She says their latest findings should settle any question about the value of making sure every pregnant woman receives iron supplements. Iron is a micronutrient. Micronutrients are important substances that are found in small amounts in foods. The researchers first completed a study among poor women in Nepal 10 years ago. During pregnancy, some of the women received supplements containing iron and another micronutrient, folic acid. Ms. Christian says that study showed the supplements could improve child survival. Now the children are older. The researchers returned to Nepal and tested their neurological development. They found improved abilities among those whose mothers had received iron and folic acid during pregnancy and for 3 months after. Another new study looks at levels of vitamin D in babies. It says newborns with the lowest levels were twice as likely to develop respiratory infections as those with normal levels of vitamin D. Vitamin D helps build strong bones and strengthens the body's defenses against disease. The vitamin is commonly added to cow's milk and also found in supplements. Vitamin D is called the sunshine vitamin. The body naturally produces it from sunlight. Carlos Camargo from Harvard Medical School in Massachusetts and other researchers did the study. It followed more than 900 children in New Zealand until they were 5 years old. Dr. Camargo said the problem of vitamin D deficiency is not limited to countries with the least sun. There are low levels of vitamin D in people living in areas where there is a lot of sun. This is because people are spending more time indoors. For VOA Special English, I'm Alex Villarreal. You can find more health reports at our website, voaspecialenglish.com. And you can find us on Facebook and Twitter with the VOA Special English Health Report. We started talking last week about how to decide if a common injury, a bleeding cut on a finger, requires medical attention. If the bleeding stops when you press on it for a few minutes, then you probably do not need a doctor. But if the injury is more serious, then you could suffer permanent damage unless you get help. Dr. Martin Brown is chairman of emergency medicine at Inova Alexandria Hospital in Virginia. He says injuries that damage a deep structure like a bone, tendon, or nerve should always be treated by a doctor. Forceful bleeding and bright red blood are dangerous signs of a deep cut. Dr. Brown says there are different medical products that can help stop the bleeding. One example is gel foam. He said gel foam is a cellulose product that promotes the clotting of blood by giving blood a surface upon which to clot. The traditional way to close a serious cut is with sutures, also known as stitches. A needle and nylon thread are used to sew the edges of the wound together. But Dr. Brown says a more recent development is a medical glue. He said the glue is a medical kind of superglue. Superglue makes many things stick together. But Dr. Brown says people should not use it on injuries. He says the medical glue can be used when a cut is straight and comes together easily. The American Academy of Orthopedic Surgeons has advice on its website about what to do if a fingertip is not just cut, but cut off. First, gently clean the amputated part with water or saline. Dr. Brown says people can use a saline cleaner for contact lenses. Saline contains salt. Next, without drying the fingertip, cover the part in gauze or a cloth. Place it in a waterproof bag and place the bag on ice. Do not put the amputated part itself directly on ice. That could damage it more. Bring the fingertip to a hospital as quickly as possible. A surgeon may try to reattach a fingertip that is cut off below the first joint. But Dr. Brown says fingertips are not often reattached if they are the length of a fingernail or shorter. He says a reattachment operation can take many hours. It is done under a microscope, reattaching nerves and arteries and tendons. Even then, he says, the result will not necessarily be better than losing part of a finger. Dr. Brown says patients must also be willing to undergo a rehabilitation process to regain use of the finger. For VOA Special English, I'm Alex Villarreal. VOA Special English Health Report. Israeli researchers say they have developed a substance that attracts and kills mosquitoes infected with the malaria parasite. However, the sweet-smelling substance is said to be harmless to people and animals. Scientists at Hebrew University in Jerusalem developed the sugary bait by combining fruit juice oils and boric acid. The fruit juice gets the attention of the mosquitoes. Boric acid kills the insects when they eat it. The scientists took the boric acid sweet bait to the West African nation of Mali. They sprayed it on plants near man-made ponds. Villagers use water from the ponds during the dry season. But the area is also home to Anopheles gambiae, the mosquito that carries the most deadly form of malaria. The researchers also placed a sweet-smelling spray on grasses near other ponds, but that spray contained no boric acid. Both substances also contained a substance that would mark any mosquito that came in contact with it. This way, the scientists could count the mosquitoes that fed on the bait. Josef Schlein is an expert on insects that affect human health. Professor Schlein led the sweet bait research. He says 38 days of results show the sweet boric acid bait proved very effective at killing mosquitoes. He said in Mali, 80% of the females and 90% of the males were killed. But the area is full of little ponds, so it is impossible to stop mosquitoes from flying from an untreated pond to a treated pond. At the ponds treated only with sweet-smelling bait, Professor Schlein says more than 75% of mosquitoes fed on the false bait. He says most people do not know that female mosquitoes feed on sweet plant nectars to survive. Their blood feedings are part of reproduction. The Israeli researchers now hope to develop a bait that is even more desirable to the malaria mosquitoes. Boric acid is generally safe for human beings and other mammals. Professor Schlein says scientists might be able to develop a mosquito bait for enclosed spaces. Boric acid has been used to kill other insects, including cockroaches, termites, and ants inside homes since the middle of the last century. A report about the malaria mosquito sweet bait was published in Malaria
Special English Health Report. In the early 1950s, researchers found that people scored lower on intelligence tests if they spoke more than one language. Research in the 1960s found the opposite. So, which is it? Researchers presented their newest studies in February at a meeting of the American Association for the Advancement of Science. The latest evidence shows that being bilingual does not necessarily make people smarter. But researcher Ellen Biastock says it probably does make you better at certain skills. She says, imagine driving down the highway. There are many things that could capture your attention, and you really need to be able to monitor all of them. Why would bilingualism make you any better at that? And the answer, she says, is that bilingual people are often better at controlling their attention, a function called the executive control system. She says it is possibly the most important cognitive system we have. It is where all of our decisions about what to attend to, what to ignore, and what to process are made. Ms. Bialystock is a psychology professor at York University in Toronto, Canada. She says the best method to measure the executive control system is called the Stroop test. A person is shown words in different colors. The person has to ignore the word but say the color. The problem is that the words are all names of colors. She explains, So you would have the word blue written in red, but you have to say red. But blue is just lighting up all these circuits in your brain, and you really want to say blue. So you need a mechanism to override that so that you can say red. That's the executive control system. Her work shows that bilingual people continually practice this function. They have to, because both languages are active in their brain at the same time. They need to suppress one to be able to speak in the other. This mental exercise might help in other ways too. Researchers say bilingual children are better able to separate a word from its meaning and more likely to have friends from different cultures. Bilingual adults are often 4 to 5 years later than others in developing dementia or Alzheimer's disease. Foreign language study has increased in the United States, but linguist Allison Mackey at Georgetown University in Washington, D.C., points out that English-speaking countries are still far behind the rest of the world. For VOA
Special English Health Report, scientists say they have found dangerous forms of bacteria in drinking water in New Delhi. These bacteria contain a gene that scientists call New Delhi metallobeta-lactamase, or NDM1. The gene is dangerous because it can make bacteria resistant to treatment with antibiotics. Researchers from the University of Cardiff in Britain led the study. They say they found the NDM1 gene in bacteria in 2 out of 50 drinking water samples. They also found it in seepage water, the water that children might play in on the streets. The gene was found in 11 kinds of bacteria, including those that cause cholera and dysentery. The researchers also reported finding the NDM1 gene in bacteria collected from medical patients. These patients were from India and other South Asian countries, as well as Europe and North America. The scientists estimate that about 100 million Indians may be carrying bacteria with the gene as they travel. Timothy Walsh leads the NDM1 research at the University of Cardiff. He says, wherever these people travel, they carry their normal flora with them, 100 trillion bacteria. Therefore, the ultimate consequence of this is it can spread worldwide. The United States government reported the presence of the NDM1 gene in 3 people last year. All had been to India earlier for medical treatment. Experts say people can stay healthy even if they have bacteria with the gene in their body. The danger is if they get sick with disease-causing bacteria. The gene can make bacteria resistant to even the most powerful antibiotics. Antibiotics are the main treatment for bacterial infections. Indian officials say the water supply is safe. Vishwa Mohan Khatak, the Director General of Health Services, says the bacteria do not usually cause a problem. However, officials in New Delhi are investigating. Timothy Walsh says he worries that the investigation will not employ the right study methods. He says he offered his team to help, but Indian officials rejected the invitation. Professor Walsh also says It is time for the international community to force countries to follow World Health Organization guidelines for antibiotic use. The study appeared in the Lancet Medical Journal. For VOA Special English, I'm Alex Villarreal. To read and listen to more stories about health and for English teaching activities, go to VOA.
This is the VOA Special English Health Report. Loud snoring can be a problem, and not just for other people trying to sleep with the noise. It can also be a sign of sleep apnea. People with this condition repeatedly stop breathing while they sleep and may not even know it. Dr. David Gross at the National Rehabilitation Hospital of Washington says, sleep apnea means that the airway, the upper airway, cuts off at night. The muscles get all relaxed and cut off, and this can happen over and over again, 60 to 100 times an hour. Most people who snore do not have sleep apnea, but doctors say most people with sleep apnea do snore. Sleep apnea not only reduces sleep quality and makes people feel tired during the day. More and more studies show that it can also lead to strokes and heart attacks. Dr. Michael Tweary at the National Institutes of Health explains why. Whenever we run out of enough air to breathe, it sends alerting signals to our minds. It raises the level of stress hormones. It tells our heart to work harder. When a person stops breathing, oxygen levels in the blood decrease. This happens again and again with sleep apnea. Dr. Tweary compares the effect of sleep apnea to racing a car engine for long periods of time. Our heart becomes overworked, and we become more vulnerable to heart attack and also strokes. Dr. Tweary led a study of about 9,000 people who had sleep apnea but no history of heart disease. The 9-year study showed that the more severe the sleep apnea, the greater the chance of a stroke. Dr. Tweary says it found that men can experience up to a 3-fold increased risk of stroke. Sleep apnea seems to be more common in men than in women, and it becomes more common as people get older. The most common form is called obstructive sleep apnea. People who have it are often overweight or have it in their family, but it can affect anyone. In children, for example, enlarged tonsils in the throat can interfere with breathing as they sleep. The next step in research will involve sleep apnea patients who have already had a stroke or heart attack. Researchers will study whether patients can reduce the risk of a second one with a machine called a CPAP. CPAP is continuous positive airway pressure. It provides a flow of air into the throat and lungs while the person sleeps. For VOA Special English, I'm Carolyn Presutti. To read and listen to more stories, report. For people with HIV, the earlier they start treatment, the better. And better not just for them. A study has shown that early treatment greatly reduces the risk that the partner of an infected person will also get infected. HIV is the virus that causes AIDS. Dr. Anthony Fauci is with the United States National Institutes of Health, which paid for this study. He says many studies have been showing that the earlier you start, the better it is for the person who is infected. But this study shows that it also helps keep that person from transmitting the virus to a heterosexual partner. Most of the couples in the study were heterosexual. So researchers cannot say if the results would be the same in men who have sex with men. The study took place in Botswana, Brazil, India, Kenya, Malawi, South Africa, Thailand, the United States, and Zimbabwe. It involved almost 2,000 couples divided into two groups. In one group, the infected man or woman began to take a combination of 3 antiretroviral drugs immediately after being found to have HIV. In the other group, the infected partners began drug treatment only when they started to show signs of getting AIDS. The researchers say both groups received equal amounts of HIV-related care and counseling. That included information about safe sex practices, free condoms, and regular HIV testing. The study began in 2005. It was supposed to last until 2015, but researchers stopped it early because the results were so clear. Only 1 case of infection was reported in couples where the infected partner began immediate treatment. Dr. Fauci says earlier treatment led to a 96% reduction in the spread of HIV to uninfected partners. He says this is a powerful bit of evidence that will go into the thinking and formulation of guidelines by the international organizations that help to provide drugs in the developing world. The study shows the value in testing and treating HIV before a person even feels sick enough to see a doctor. But in many countries, public health budgets are already stretched thin. In sub-Saharan Africa, the area hardest hit by AIDS, for every person who gets treated, 2 others go untreated. Antiretroviral drugs suppress the virus. Once people start treatment, they have to continue it daily for the rest of their life. For VOA Special English Health Report, today we answer a question. Vu Wang Hin from Vietnam wants to know more about hepatitis B. Hepatitis is the name for a group of viral infections that attack the liver. These are called A, B, C, and so on. An estimated 2 billion people are infected with hepatitis B. The rates are highest in China and other parts of Asia. The World Health Organization says most of these infections happen during childhood. Hepatitis B is spread through contact with infected blood or other body fluids. Mothers can infect babies at birth. Unsafe injections and sexual contact can also spread the virus. Experts say it can survive outside the body for at least a week. There are 2 forms of hepatitis B, acute and chronic. Acute cases last for several weeks, although recovery can take months. Chronic cases can lead to death from cirrhosis or scarring of the liver and liver cancer. Yet people with long-term liver infections can live for years and not even know they are infected. The ones most likely to develop chronic hepatitis B are young children. In the United States, public health experts recommend that Asian Americans get tested for chronic hepatitis B. This is because most Asian Americans came from countries with high rates of the disease, or their parents did. For acute hepatitis B, patients may receive care to replace lost fluids, but there are no treatments. Doctors can treat chronic cases with interferon and antiviral drugs. But these medicines cost too much for most of the world's poor. A vaccine to prevent hepatitis B has been available for 30 years. The researcher who discovered this vaccine and hepatitis B itself was an American named Barack Bloomberg. Dr. Bloomberg also showed that the virus could cause liver cancer. He and another researcher at the Fox Chase Cancer Center, Irving Millman, invented the vaccine in 1969. But Dr. Bloomberg said it took some time to find a drug company willing to produce it. He first became interested in studying infectious disease when he volunteered in Suriname during his medical training. His discoveries with hepatitis B saved many lives and earned him a Nobel Prize in medicine. But he also had other interests, including the search for life in outer space. In the late 90s, Barack Bloomberg helped launch the Astrobiology Institute at NASA. He was at a space agency conference in California in April when he died, apparently of a heart attack at the age of 85. For VOA Special
This is the VOA Special English Health Report. International donors have promised more than $4 billion to the Global Alliance for Vaccines and Immunization. That group, known as the Gavi Alliance, held a pledging conference in June in London. Gavi raised $600 million more than its goal. Britain led the donations with $1.3 billion in new pledges through 2015. The Bill and Melinda Gates Foundation also promised $1 billion more over the next 5 years. Norway promised more than $670 million. The United States made $450 million in new pledges. Gavi says a record 50 countries requested money for vaccines during its latest application period. Earlier, vaccine makers agreed to cut prices for developing countries. These lower prices, combined with the money raised, could protect an extra 250 million children. Gavi spokesman Jeffrey Rowland says the goal over the next 5 years, by 2015, is to save an additional 4 million lives. He says this will be done purely by providing basic vaccines against diseases that are almost non-existent in rich countries, as well as providing new vaccines against pneumonia, diarrheal diseases, and then hopefully HPV and some other vaccine-preventable diseases. HPV is the human papillomavirus, which can lead to cervical cancer. The disease kills 200,000 women a year, mostly in developing countries. The Merck company has agreed to offer Gavi the HPV vaccine at $5 a dose, 2/3 less than the current price. Also, 2 India-based companies, Serum Institute and Panacea Biotech, will reduce prices on vaccines against 5 diseases. These are diphtheria, tetanus, pertussis, hepatitis B, and Haemophilus influenza type B. Other companies, including GlaxoSmithKline and Merck, will lower prices for rotavirus vaccines. That virus causes diarrhea, that kills about 500,000 children a year. Mr. Rowland says almost all children in the world get rotavirus. The thing is that in the United States or in Europe, children usually have good access to medical care. Children in poor countries, on the other hand, usually do not. A rotavirus vaccine in the United States can cost as much as $50. Under the new plan, this same vaccine could cost about $2.50 in a developing country. The Gavi Alliance says almost 2 million children a year die from diseases that vaccines can prevent. For VOA Special English is the VOA Special English Health Report. New estimates show that more than 1 billion people have a physical or mental disability. Experts say almost 1/5 of them experience serious difficulties in their daily lives as a result of their disability. And disability rates are increasing as populations get older and more people get long-term conditions like heart disease and diabetes. The estimates are in a report from the World Health Organization and the World Bank. The World Report on Disability says few countries do enough to meet the needs of the disabled. They face problems like discrimination and a lack of health care and other services. They have higher poverty rates and lower education levels than other people. This is true in both rich and poor countries. Cindy Lewis is the Director of Programs for an organization called Mobility International USA. Ms. Lewis says people with disabilities helped write the new report. One of its messages is that people with disabilities should not only receive services, they should also help design and provide them. Ms. Lewis says that way they can become decision makers and policy makers. People with disabilities are a huge and untapped resource for governments, communities, and development programs. And that is a big problem that we are working on addressing. Ms. Lewis says in many countries, people with disabilities are organizing to support disability rights. It's a very incorrect assumption that people with disabilities are in their community sitting around passively waiting for something good to happen. People with disabilities around the world are getting together and mobilizing and speaking out. Her group is working with the United States Agency for International Development. The projects bring together disability groups and development organizations in Colombia, Jordan, and Ethiopia. The United Nations has a human rights treaty called the Convention on the Rights of Persons with Disabilities. Almost 150 governments and regional organizations have signed it. The World Health Organization and the World Bank say people with disabilities should be able to use the same services as everyone else. They call for more laws to give the disabled the same rights and chances to succeed as everyone else. These laws, they say, will help the public understand that people with disabilities also have abilities. For VOA Special English, I'm Alex Villarreal.
This is the VOA Special English Health Report. Everyone knows life for refugees and migrant workers can be difficult, dangerous, and even deadly. But what happens when they return home? One of the biggest problems for migrants is getting health care as they travel and live in a new place. As a result, they often bring their medical problems home with them. A new report looks at this situation. The report is from specialists at the International Organization for Migration in Geneva, Switzerland. One of those authors was Haley West. She says migrant workers who get injured on the job may not be able to get treatment in the country where they are working. That lack of access to medical care means they have to deal with medical problems when they rejoin their family. So that delay in diagnosis oftentimes leads to worse health issues that could have potentially been preventable if they had been given the access in the country in which they had been working. Not all migrants travel for economic reasons. Many are forced from home by natural disaster, war, or civil unrest. And not all health care needs are physical. Another author of the report, Rosalind Borland, says refugees may face years of mental health problems. Another problem for returning migrants is that they may not have much to return to, she says. If the community was destroyed by the natural disaster or the war, then the health system has also been damaged, and the ability of that community to continue to keep people healthy is also challenged when they get back. The authors of the article call for policies to consider the needs of returning migrants and to make sure they can receive health testing. The report appeared in a 6-part series on migration and health in the Public Library of Science journal, PLOS Medicine. The journal editors say, if internal and international migrants comprised a nation, it would be the 3rd most populous country in the world, just after China and India. The editors say population mobility is among the leading policy issues of the 21st century. They say officials have not given enough attention to policies to protecting migrants and global health. And the efforts have been made more difficult by a lack of coordination between countries. For VOA Special English, I'm Mario Ritter.
In Africa shows that AIDS drugs can increase life expectancy in patients to nearly normal levels. One of the authors was Dr. Jean Nishega of South Africa's Stellenbosch University and the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. He says the major finding is that patients in Africa receiving antiretroviral therapy for HIV can expect to live a near normal lifespan. The findings appear in the Annals of Internal Medicine. Over the last 30 years, the HIV/AIDS epidemic cut 15 to 20 years or more from life expectancy rates in Africa. Dr. Nishega says those rates had gained sharply in many countries in the past because of access to clean water and expanded immunization programs. The study took place in Uganda, where life expectancy at birth is an average of about 55 years. The study involved 22,000 patients being treated for HIV. The results were promising, but were different for men and women. At age 20, life expectancy for men was another 19 years. Women could expect to live 30 more years. At age 35, men could expect to live to 57. Women could expect to live to 67. Dr. Nashega says men generally start treatment later than women. By then, the disease is less treatable. He says one reason men wait may be because they spend more time looking for a job and a way to survive. The second reason is obviously the issue about stigma, which still affects a majority of people in the community. Also, programs for pregnant women mean that women have more chances to get tested for HIV and to receive treatment. Dr. Nashega says health officials need to deal with this gender imbalance. He also says we should no longer see treatment and prevention totally separately. He says treatment of HIV/AIDS is a part of prevention. Because by treating people and hopefully treating them earlier, they are less likely to transmit the virus to their sexual partner. Studies also show that giving antiretroviral drugs to uninfected people can help protect them from HIV. 2 recent studies found that taking medication daily reduced the risk of infection in heterosexuals. An earlier study showed that it reduced the risk among gay men. For VOA Special English, I'm Carolyn.